Hello guys, today we will be learning about brachial plexus. This might seem difficult but it actually is an easy topic. Okay, so what is brachial plexus? It is actually a plexus of nerves formed by the cervical and the first thoracic spinal nerves. So let's start. The roots come from the spinal nerves. So I'll just write down the roots. C, B, root, trunk, division, cord, branch. You can say like rods, pells, dogs can bark. Okay, so that's a good mnemonic, right? You can choose your mnemonic whichever you feel easy. Okay, now let's talk about the roots. C5, C6, C7, C8 and T1. These are all spinal nerves. Now trunks. C5 and C6 together form the upper trunk. C7 alone forms the middle trunk. C8 and T1 together forms the lower trunk. Okay, so I'll just write that down. Upper trunk, middle trunk and lower trunk. Now division. Each trunk forms an anterior and a posterior division. Anterior, posterior, anterior, posterior, anterior, posterior. I wrote it like this for ease of drawing. Okay, that we'll come to know that. Now let's talk about the chord. The anterior chords of middle and upper trunk together form the lateral chord. The posterior divisions of all the three trunks together form the posterior chord. Posterior chord. It's easy to remember because posterior division, posterior chord. Now anterior trunk forms the anterior division from the lower trunk forms the medial chord. Now the branches, right? M, A, R, M, U. Musculocutaneous nerve, axillary nerve, radial nerve, median nerve and ulnar nerve. Okay, now the musculocutaneous, it receives its branch from the lateral cord. Then the axillary and radial nerves receive their branches from the posterior cord. Median nerve will receive branch from medial and lateral cord, and ulnar nerve from medial cord. I'll use a different color just for better understanding. Now let's talk about the branches. From the roots, we have mainly two branches: dorsal scapular nerve and the long thoracic nerve, which comes from C5, C6 and C7, long thoracic nerve. Then from the trunks, mainly only from the upper trunk there are branches: suprascapular nerve and nerve to subclavius. Then divisions, we don't have branches to mention. And from the cord, what all branches do we have? From the lateral cord, we have the lateral branch to median nerve and lateral pectoral nerve and the musculocutaneous nerve branch, lateral pectoral nerve. From the medial cord, we have medial root of median nerve, medial cutaneous nerve of arm and forearm. Okay, and we also have medial pectoral nerve. From the posterior cord, we got the branch to axillary and radial nerve. Then we also got a branch called the thoracodorsal nerve, upper subscapular nerve and lower subscapular nerve. Okay, so basically this is what brachial plexus is, right? This is not that complicated, is it? Now let's talk about some clinical correlations. Like they might ask this in exams, so that's why I'm going to stress on this. First, we need to know what is Erb's point. It might be a 1-mark question. Sorry for that. Erb's point. Anterior division and posterior division from the Okay, the herbs point. We know the roots C5, C6. They join together to form the upper trunk. Along with that, we have the suprascapular nerve and the nerve to subclavius. Then this gives anterior and posterior divisions. This point where 1, 2, 3, 4, 5, 6 nerves meet together. This is called Erb's point. Okay, then correlations, clinical correlations. Lesions of brachial plexus. The brachial plexus, mainly if these nerves are affected, the muscles that are connecting those nerves will also be affected, right? So there are two main paralysis that we should learn: Erb's paralysis and Klumpke's paralysis. Let's talk about Erb's paralysis. In Erb's paralysis, the roots affected are, nerve roots affected are C5 and C6, which means upper trunk is affected. If upper trunk is affected, mainly the musculocutaneous nerve will be affected. Musculocutaneous nerve will be affected. Why? See, upper trunk, lateral cord and musculocutaneous. And lateral cord also has branches to median nerve, and these division, posterior division is connected to axillary and radial nerve. So in short, the muscles that mainly are affected by this are deltoid, supraspinatus, infraspinatus, biceps brachii, brachialis, brachioradialis. Basically, most of the arm muscles, brachioradialis, supinator, and extensor carpi radialis longus. And it is also called policeman's tip. Then sensory loss, if those nerves are affected, they also have sensory supply, right? So those sensory parts are lost, right? So it can be along the outer aspect of arm. Now let's talk about Klumpke's paralysis. Klumpke's paralysis, the nerves affected are C8 and T1. Let's go back to the drawing board. C8 and T1, lower trunk, posterior division, anterior division, medial cord. So ulnar nerve will be affected, and also posterior division, posterior cord, radial nerve. So these nerves and ulnar nerve are affected. So accordingly, the muscles include intrinsic muscles of hand, and its special position or position of the hand is called claw hand. Sensory loss is along the medial border of forearm and hand. One thing to be noted here is an autonomic sign called Horner's syndrome is present. Horner's syndrome. What is Horner's syndrome? It is a syndrome that is characterized by partial ptosis, meiosis, and hydrosis in ophthalmos. Ptosis. Ptosis means drooping of the eye lid. Meiosis. which is an extensive construction of the pupil of eye. Then anhidrosis, inability to sweat normally. Anhidrosis, inability to sweat normally. The name itself explains this. And enophthalmos. Enophthalmos, we know about exophthalmos, right? In exophthalmic goiter. So enophthalmos is actually a posterior displacement of eyeball within the orbit. As simple as that. So guys, this is all about brachial plexus. That is mainly what we need to learn. And thank you for listening. Please do not forget to subscribe and like the video. Thank you.